Facing growing margin pressure from declining reimbursements and rising supply costs, Mercy Health adapted its operations to position itself for long-term success. With perioperative services representing 42% of total revenues and as the leading source of supply cost, sustaining margin performance meant transforming the OR supply chain for 259 operating rooms across their 44 hospitals. To break down operating silos and streamline processes across stakeholders, Mercy Health created a multidisciplinary Center of Excellence team with deep ties to operations and a strong culture of collaboration to identify and address opportunities across the OR supply chain. They found that OR staff was spending too much time in front of the computer performing manual documentation of supply consumption while dealing with the implications of inaccurate preference cards and picking mistakes. This resulted in case cart contents that didn't match intraoperative needs. The OR staff needed to be unshackled from the computer and to avoid urgent supply runs and rush orders during procedures in order to prevent disruptions and maximize throughput. Physicians lacked the necessary data to compare and contrast the cost of their cases and had no means of collaborating with one another to streamline and reduce variations in products, information which would empower supply chain to standardize products and increase volume for better pricing. Supply chain lacked visibility and control on inventory and needed a solution that bridged the gap between the ERP and the EMR to manage all types of OR inventory in a single system, one that embedded best practices for inventory management, case cart management, and improved collaboration with physicians and OR staff. What Mercy Health needed was a system so integrated that it connected the seemingly disconnected and populated the EMR without burdening the frontline staff.
It's really about how do we accomplish the goals we want in inventory management, in preference cards, and then how do we augment the clinical workflows and the supply chain workflows so they make sense. And so while you need the correct solution, you also need to be able to design processes that make sense for both sides. And so we really picked Tecsys really because they were able to help us design those together, and they were willing to work on this as a true integrated solution that really solved all of our problems.
Most supply chain people will tell you our goal is to get the product to the edge of the clinical area and allow the clinical area to manage it and to do our best, as best we can, to not interfere with patient care. When I met Betty Jo the first time, her issue was around preference cards. And really, how do you optimize preference cards? And as we talked and got deeper into the issue, it really became more obvious that it was an inventory management problem. The problem is we did not have any strategic supply chain actions happening, and a couple things we're interested in from a supply chain perspective. One is the realization of assets, inventory reduction, specifically around days inventory on hand, and the adoption of UDI throughout our system, specifically around post-market surveillance, and really getting to the point of comparative effectiveness.
In Mercy, we've set up a structure we call specialty councils, which allows physicians of the same specialty to communicate and collaborate with physicians of the same specialty from other communities. The data from this project is actually shared with individual physicians, people in their own individual group, and they compare their group to everyone across the entire organization. That helps lead into the competitive nature. Well, how are they able to do that, and how were they able to do this, and a lot more collaborative learning across the entire organization. As physicians share this data from across the organization and learn from each other, they learn not just about the financial aspects of it, but also dig into outcomes. They're able to compare and contrast how patients actually do and learn from each other. This ends up resulting in decreased variation within a community and from community to community in terms of how the process is undertaken. This process provides several advantages to the operating room. It decreases significantly the amount of inventory on shelf, saving significant costs. It allows physician preference cards to be accurate, making sure we get exactly what the physician wants and is using for every case. It decreases the amount of back and forth walking that happens in the OR, making sure all the scrub techs go and get the types of things they want to use. It's all delivered to them at one time accurately. So it actually decreases overall throughput in the OR as a result as well.
So some of the clinical benefits that Tecsys has given us is it's allowing the circulator to be in the room. It's giving us everything we need for that case. So it's actually speeding us up. When we first went live with this, We were kind of expecting maybe a few delays, but it turned out that we got ahead, that we were having to call patients in because we were getting so far ahead on the schedule. The dashboard's helping me with my workflow because I can see the status of the case. So I know if I'm going to have a hang-up or a delay in any of my rooms, I can go ahead and fix the problem before we reach that problem. One of the biggest benefits here at the Orthopedic Hospital is with our implants. We do a lot of implants, as you know. So being able to do the one scan and be able to get the lot number, expiration is saving on human error just by typing in all those numbers. And also it's a safety factor because scanning those first, it will actually alert us if that was an expired product or if there was a recall. The new process did improve the compliance for tissue tracking. Before we had to put things in a tissue tracking book that a lot of times nurses would forget to or they would leave parts out. So this way we have all the information we need right inside the chart so we can find it very quickly. We did have a Joint Commission come in after we implemented this and they loved the process.
As a clinician and seeing new software come in, I myself was hesitant because having experiences in the past and it not necessarily helping me on a daily basis or my flow, but this software is not that way at all. It integrated enough to where it lessens my time on the computer. It allows me to be more available for my staff in the room, be available for the team of their needs, and when my patient arrives, it allows me to have a lot of things done prior to my patient entering the operating room, and then my focus is on my patient. Before, we had to key in a lot of things, as for instance our load numbers that are from our sterilizers that would follow that patient. We constantly had to put those in by hand.
Our supply cards are basically downloaded onto our handhelds, so our pick list is all on our scanners, so when we go through, we don't have to worry about the papers or anything like that. We can just run through and scan and not have to mess with paper. The accuracy is 100% because you can't, the handhelds do not let us make a mistake. We have fewer calls as long as there's no emergencies in the rooms. We have fewer calls of supplies that they need extra, which is always a good thing. And when we do our returns, when they bring them back to us, the returns are a lot easier to put away. We just have to scan what's there and just put it back on the shelf. The non-tissue implants come in from the dock. We will scan those in. We will enter the lot numbers in with those, and then before they're received in, they go on the shelf. And we can track those through the system just by the lot number and our Lawson numbers, and we can tell by the dates, and it puts them all in order. So we know which ones go first, which ones go last, and it breaks them down to how many days before they expire, which is really, really cool. And then we can track it through the entire system till the time it goes into the patient and let us know to reorder. There's so many different things that makes it a lot easier to do. You're transferring from one location to another, being able to see where every item is in the entire building almost at a glance, and being able to see how many items you have in different locations of the exact same item all in one glance is really neat. It's helpful, it's beneficial.
Having Tecsys allows both clinical staff and supply chain staff to interact in such a way where we can come up with solutions rather than point fingers and cause blame. Culturally, it's been a tremendous impact. The interaction that ROR has with supply chain has just been fantastic ever since we implemented Tecsys. It allows us to take that data in terms of usage and things going to the OR and being used in cases. It allows us to look at pref cards and effectively manage them, if you will. So I can go to a clinician with numbers and tell them, well, you've pulled this 50 times, you've used it once, so maybe we need to think about taking that off of the preference card, things of that sort. The interactions have been getting easier. Whenever you go to a clinician and you show them data and things they can actually speak to, it makes things a lot easier in terms of getting a change to happen. Before Tecsys, we weren't able to really look at what we were using. After we implemented Tecsys, after about 6 months of usage, we could take that data and look at some items maybe that didn't have the movement that we were expecting. In doing so, it allowed us to draw our inventory back, reduce inventory value. Having sterilization details attached to trays and being able to put those into a patient's chart and Epic, it's been fantastic in terms of sterile processing. Having that ability to track those things, it covers us as a facility and it helps with patient safety, which has been a fantastic benefit. Tecsys, it has allowed us to take simple processes, and case pick is a great example, and put that in such a way that we can speed up our everyday, get through the work faster so I can do more with less with my department.
We have really solved problems that have been in the industry for 40 plus years. And we are getting to the bottom of some very important points. So this solution not only incorporates products, it incorporates instrument trays we use in the OR, tissue tracking in the OR, regulatory requirements, cost, outcomes. It really does wrap around our whole central theme in perioperative services around the triple aim, which is quality, service, and cost. And Tecsys is meeting us on every single level.
The Mercy Transformation Project is expected to generate a total of $21 million in savings, including $2.4 million in the realization of unrecognized inventory assets, $4.7 million by improving inventory utilization, and optimizing charge capture by $13 million. But the project has also reduced OR turnover time by 12%, increased frequency of preference card optimization by 284%, and improved clinical work satisfaction by 37%. Tecsys Healthcare. Fulfillment at work.